move this table closer to her so she
Yes,
can
sir.
see it? Or maybe you can fit her in there with you and then we can just all look at it. Would you like to come sit with me?
You wanna
Sure.
sit?
Yeah.
Let's see, Morgan. Okay.
So is this your specific field?
It
Okay.
is. I only see AML and MDS, and I actually have a special focus on P53 mutations. So, let's see. So, have you ever seen a bone, like a chicken bone?
Oh, yes.
If you break it in half, you can see that the inner part, it's all about this trabeculae, right? And it's kind of soft inside. So it's the same for us. And that's the bone marrow part of it. And inside that bone marrow, there are these cells called stem cells,
Mhm.
okay? And we're all born with like 10 to 40,000 of them, and that's all you get all your life.
Stem cells?
Blood stem cells, yes. And they're pretty smart, and they're able to make all the types of cells that people need. So one of those are white blood cells. The other one are red blood cells, but we count the hemoglobin, as you know. And the other one are the platelets. And all of these cells, they're all meant to die at some point. That's their normal life. These guys live like 3 to 5 days. The red cells live about 90 days. And the platelets live about 2 weeks. Okay? So they go through this process, they become their final form, and then they die off, and then it happens again. This happens our whole life, forever. Now, when we do a blood work, we see the end product, right? And so we see the final forms, but to look at the factory, we do the stem cells. We have to do a bone marrow test. That's why we do that.
Mhm.
Now, in your case, you had you had this mutation called JAK2,
Mhm.
and that one is a mutation that makes cells grow very quickly and kind of out of control. And sometimes it can be the red cells, sometimes it can be the platelets. In your case, it was the platelets.
Okay.
And you had that for a long time, which is kind of the typical story, but after a while, all that stress on the stem cell causes the stem cell to try to control that. And one of the things it does to try to control that growth and that stress is it acquires new mutations. So inside the nucleus here in the DNA, that's where in your case we find this JAK2 mutation. And until recently, that's kind of all you had. But then it showed up this other mutation called TP53.
Okay.
So what does that mean? So TP53 is the supervisor that tells all of these cells when to die. And if it doesn't work, they don't die, they just stay alive. And what happens is these stem cells, they start growing and making more of their own. Instead of making the cells you need, like the hemoglobin, they just start making more stem cells. But these stem cells never turn into good guys. And when we see some of these stem cells just kind of sitting there, taking up the space of the good cells, we no longer call them stem cells and we call them blasts.
Last.
Mhm. And if you have more than 20% of these, then you have something called AML. In your case, because you had ET before, essential thrombocytosis, you have something we call secondary AML, because you had a blood problem first and then it turned into another problem.
Mm-hmm.
So this is what we're dealing with now, okay? In general, people can get to AML from several different ways, and having ET is one of them. Some other people have MDS, some other people just show up with AML straight away from the beginning. And what we know is that when you have another problem before your AML, treating it is harder. Because your body is used to taking chemotherapy, this JAK2 makes things grow, and so it kind of overcharges. This thing tells cells when to grow, and this is affected, and this thing tells cells when to die, and this is also affected. So these blasts are very likely to just keep growing and growing and growing. Okay. So what are our goals here? So the first thing to say is, this is treatable, but it doesn't go away.
Mhm.
With treatment, it doesn't make it go away. So it's not curable unless you do bone marrow transplant. And even if you do bone marrow transplant, when you have P53, it usually comes back 3/4 of the time. So it's hard to treat. And so, you let me know if these goals sound good. Number one,
The goals sound good?
goals of therapy.
Okay,
Number one goal I think should be to stay out of the hospital.
mhm,
Because when we start treatment for leukemia, there's about a 20% chance that people end up in the hospital, not with something serious, but with an infection or with some sort of bleeding event. Okay. Number two goal should be to make you transfusion independent, meaning you don't need transfusions because you need them today, actually. And so transfusion independent, and this goes hand in hand with increased energy. Because if we make your hemoglobin higher, 8, 9, 10, you'll feel better.
mhm,
You'll notice it right away.
mhm.
And
So
number
what was it today?
7.
Oh,
Yeah.
it dropped quite a bit then from 3 weeks ago when I had my blood work done.
Yeah. And this is a real estate problem because these blasts are just taking over the space where the red cells are supposed to be. And then number 3 would be something called remission.
Mhm,
So remission is getting rid of the blasts,
mhm,
but there are several levels to that, because while we're getting rid of the blasts, these cells, the normal ones, they can go up, and that's the best thing that can happen. That's the optimal thing. They go up at the same time your blasts are going down. That's what we call complete remission.
mhm.
But some patients that have secondary AML, they usually just have everything go down along with the blasts, and that means that they need transfusions once or twice a week because of that.
Blood transfusions?
Blood or platelet transfusions.
Hmm.
It must be weird for you to even hear platelet transfusions when yours have been high for so long, but those things can happen. And so, how do we get here? There are 2 treatments for AML. One is called intensive chemotherapy. This is usually reserved for people 60 and younger. If we do this, you will certainly go to the hospital, you feel terrible, it may not accomplish anything, put you in the hospital, you have a bad infection, something bad will happen. The second treatment is what your doctor recommended, but I think that we should think about a little bit of change. So one is, I prefer, and this is just based on how easy it is for you, instead of azacitidine, which is the medicine that he recommended, injection, I recommend you do decitabine. Why? Because it's only 5 days, and because it's IV. And I'll tell you why I prefer the IV over the shot. The shot is painful, and the shot you need to take for 7 days straight, and you may need 1 or 2 shots every day
Okay,
for 7 days. And that gets old very quickly, believe me. Because I have patients who had said, let's try the shot, and then they don't like it. And so I usually like to do the IV, 5 days, takes about 30 minutes, and you're done. Okay?
okay,
And then the other one is the same one. It's called venetoclax. Now,
That's the pill.
that's the pill. Now, if you go look at the label from the FDA about venetoclax, it'll say that 28 days. But I assure you that no one who sees only leukemia does 28 days. Because everyone ends up getting transfusions, their numbers go way down, and it's just intolerable to most people. So at the highest level, I would do 14 days, and even maybe I would say I would even start 7 days before we do 28. I think 28 is too much. Even for a 50-year-old, it may be too much.
okay.
So start 7 and see where she is, or start 7 and take off
I
the
would
rest
say,
of the month?
so I would say, what you said. So 5 days of the decitabine, and then 7 days of venetoclax, and see where that gets us
Okay.
as far as the blast percentage.
So it is concurrent?
Yes.
It's 5, okay.
Yeah, and so the way this looks like is like this. You have 1 week, week 2, week 3, week 4. For the first 5 days, you do decitabine, and for the first 7 days, you do venetoclax. And then you rest. But you need to check labs twice a week during this period, because the expectation is that this will make your numbers go down and then go up towards the end of the cycle. Okay, this is
What will make the numbers go down?
the treatment.
The treatment?
The treatment will make them to go down at the beginning, so the first 2 weeks, everything will be lower. You may need blood transfusions, platelet transfusions. But the idea is that in the second 2 weeks, things will start recovering and your good cells will start coming back.
Okay.
Great.
Whew.
Okay, so then how does she?
It's not really much different than our original plan.
Well, I think it sounds a hell of a lot better.
Yeah, no, I'm just saying.
So is this a, IV that Dr. Hadadan will have there at the clinic?
They can do that over there, yes.
Okay.
And the pills, they can do that as well.
Mm-hmm.
And that's just something you take along with it. And then you have to do labs twice a week. I would suggest you do that.
Okay.
And if you want to start 7 or 14 days, anything in between would be okay with me. I would never go above 14 days. Because the risks of getting a bad infection are very high.
On the
They're
pill.
high already, yes. They're high already with this, but I would never go over 14.
Okay.
So how does she do the treatment with you versus Jeff City? Because they didn't tell us any of this there.
So we do treatments. So I could try to, what I can do, because he's been your doctor for quite some time, right?
Yes.
And so what I could tell them is, would be our recommendation. Are you okay with doing this over there? You can just do that over there. And I do that all the time with the docs that are out in the state or in Illinois. And then we just talk it out, and I tell them like what I think and why I think this is the best way to go. Most of the time they say yes.
Can you work with, if she does stay in Jefferson City and do this, can you be in touch with them?
Oh yeah. Yeah, usually that's how it works. And you know, after 1 cycle of this or 2, so after 2 months of starting treatment, I would strongly suggest you come do the bone marrow here, because we have extended genetic testing and we have a better idea of how things are going.
Okay.
So.
Okay, tell me that again.
After 2 cycles of treatment, so
That's
2
2
months,
months.
you come back and do the bone marrow to see how we're doing. The bone marrow test.
Okay, bone marrow aspiration.
Yes.
Okay.
Sweet.
Okay.
Great.
Okay, so you can guarantee that they would do the same thing there that you recommend?
Yeah, I would talk to them. I cannot tell them what to do. I can suggest like, this is what we do, what do you think? And they say yes, then they do it.
Okay.
If not, I can let you know, and then you can see what you think.
And we just do it here.
Hmm?
Then we would just do it here.
Well, I think Dr. Hadadan is
But, yeah.
open to suggestions and
Yeah.
ideas.
I mean, he's right that the label says 28, but we meet in our groups about just AML, and it's called blast-based MPN is how they call this, and nobody would do 14. It's just we call it too myelosuppressive. Your numbers will drop too much too quickly, and then it leads to hospital stays and fevers and things like that.
Okay.
So do you also recommend that she gets a blood transfusion or a platelet transfusion
get
up
a-
front?
No, but blood transfusion you would need it. I would do one as soon as you can, so today or tomorrow.
Okay.
I don't think we can get you in today. I can try. It would probably be until later in the evening we will be able to do that.
That's okay.
I think you'd feel better with it too.
Okay.
I think you get some energy back from that.
Mm-hmm.
And during treatment, this first 2 weeks, things will go down. And so you may need transfusions every week during those first 2 weeks.
Okay. So how do you then communicate all this with Dr. Hadadan? Because he wants to start me next week and I'm gonna get going.
I can talk to him if we have his information. I think we may have it. I can check. I see it here. 573-5656. Jefferson City Medical Group Chemo. 1241 Stadium.
Okay, I have his fax.
I know.
Is it this one? 573-556. 1701.
Get my phone out, honey, I have his,
I think that may be.
Where's your phone?
it's in my purse, I have his number.
We do have a home here to stay in, my brother lives here.
Yeah.
Would you recommend that she came here?
It's more streamlined when you do things here, just because we do it all the time. So when our infusion center is down the hall from this clinic, so you just get it there 20 minutes, you go home. If you need a transfusion, we schedule it on the same day. And so there are benefits, I think, but I don't, it's really up to you.
Yeah, do you wanna be in your home or are you okay with being at John and Heather's?
Well,
Cause we'd only have to come here for a week, right, and then come back weekly for blood tests,
I would say twice weekly.
twice weekly.
So I would say maybe Tuesdays and Fridays for the blood tests and possible transfusion, depending on what the results show. And then the 5 days of treatment are all in a row. We can start like Monday to Friday of next week.
Oh, and the other thing would be, okay, so on, when we're here, it's just a 20-minute, is that correct?
The infusion takes about that
Okay.
time. I mean, it may take longer for you to get there and then they check you in and all that stuff. But the
Okay.
infusion itself is 20 minutes.
Okay. So, even when you say it's not curable, and we knew that, but it can go into remission. So,
Mhm.
what does that look like? According to the blood tests, you say, hey, everything's,
So, yeah. So the remission looks like you're not needing transfusions, you're feeling better in general, energy perspective. And then the bone marrow shows no blasts, no bad leukemia cells.
Okay,
That's how remission looks like.
great.
It's harder to get into remission when you have secondary AML. And it's also harder when you get P53.
also harder to write.
When you have this TP53 gene that's abnormal. Because many of the chemotherapies rely on that working to be able to work. And so I would say our chance of getting in remission where your numbers come back and your blasts come down is about 1 in 3, about 30%.
Okay.
The chances of us getting the blasts down, but also bringing down your numbers, I would say is about 50%. And that would be called a marrow remission, but it's not as great for you because you're still feeling tired.
Because what?
You're still feeling tired and fatigued, and you're still needing transfusions.
Okay.
And that brings me to the other point that I think you all should know is once this comes back, and it depends really. If you go into remission, it can last for several months. And then we reduce the doses and we just keep you on it kind of on a maintenance regimen. But when it comes back in the future, it's really hard to treat and it doesn't respond to many things.
Okay.
Okay. So this is Dr. Hotterdown's phone number. I don't know if that's what you have.
That's what I have, yeah.
Okay.
But let me just write it down here.
Mom, I think we should start out here.
That's another thing we can do is that we can start here and then if things look good and then you can continue over there later.
Great. What do you think, Grammy?
It's your decision, but I'm hearing a lot more information here and a lot of, with the blood transfusions and all of that.
So
And they can streamline it here.
do you mind running through all this again for me, please?
Yeah, not at all.
I'm sorry, I just lost everything.
It's very complicated. It's very complicated for the medical students I teach as well, so don't feel bad.
She's a nurse, she's a nurse.
What type of nursing did you do?
I worked at a nursing home.
How long?
Oh, 20 years at the most.
I've seen it all. So, you started out with essential thrombocytosis, right?
Mm-hmm.
You had that for 15 years.
Yes.
These stem cells were affected by this over time. And so over time, they gained this mutation called TP53,
Okay.
and this turned into something called acute myeloid leukemia, which is a blood cancer. Okay? This is hard to treat leukemia, But with this treatment that combines decitabine with venetoclax, this is a 5-day IV.
5-day IV, okay.
The venetoclax is a 7 to 14-day pill.
okay,
With that, there's a chance about 30% of getting in remission. Remission means you don't need transfusions, you have more energy, and we kill the blasts, the bad leukemia cells. This
so
usually,
how long does this take?
usually you see it in after the first treatment.
Oh, are you
Yes.
serious?
I am. After the first treatment, we should see a sign of things getting better, especially because, when you start, the first 2 weeks, your number will be lower. Okay?
Mhm.
And then as time goes by, your numbers start recovering. So if we see that recovery be pretty good and sharp, then that's a good sign for you that you get into a remission.
Mhm.
Now, this remission usually for P53 leukemia lasts about 4 to 6 months. And then we either need to do something else or we go towards kind of supportive care transfusions. Okay? But that's the average time. Some people have someone on just decitabine who's been out a year and they're working, so you never know really what's going to happen. This is kind of the average of all people pulled together.
So, but if I go into remission, it doesn't last very long,
That's right.
okay, and then I have to do blood transfusions or,
Yes.
okay.
Maintenance.
Mhm.
We got this.
And, we have John Heather's house here, we're 2 hours away, Mom. I know you've been seeing Hadadan and you trust him, but, I like this
Well, I
a
think
lot better.
I think it's a wonderful program, or whatever, not called a program, but,
And you can't feel bad about hurt anybody's feelings. What's most important is your health.
Yeah.
so when could I be admitted?
No, this is all outpatient.
Oh, okay, okay.
We can start Monday.
It's your decision.
Well, I'm gonna do it.
Yeah.
Here,
Mhm.
here.
Yes,
Okay.
but can I get a blood transfusion today, or what did you?
Yeah, I can go talk to them to see if they can fit you in.
Okay,
It may not be here, these guys are usually full for the day, but we have a kind of like an acute care center just for our patients called a cancer care clinic. It's near to the hospital side. You can go in from the inside, and sometimes they can do it. But I'll have to go check with my nurse to see if they have
Okay.
If
Mhm.
not, as soon as possible in the morning, cause we can
Yeah.
stay tonight too.
yeah,
So,
we can do that too.
Love it.
Whew.
Thank you
Are
so
you okay with
much.
that? I don't think we have any choice,
Yeah.
Mom.
Oh, I agree with that, I think the option is, I don't think there's any. So how do we tell Dr. Hadadan, or how do you communicate with him?
I can talk to him.
Okay,
I'll just call him and tell him like, we're gonna start here, if things look good, then you may go back to him and they can continue it over there for the follow-up if that's gonna be easier for you.
Mhm.
I have no problem with the
okay,
arrangement.
right, okay,
Sweet.
so we could, what is today? Today is
Tuesday.
So when would you want us to start?
I'd say Monday, just because that way you'll be getting treatment Monday to Friday,
Okay,
because it's a 5-day.
mhm,
And then I think we should start with 14 days of the pills. And then
Okay.
Go from there.
okay. Okay, well, I'm in.
Alright,
Thank
let's
you.
try that. And then during the treatment, you may hear from us about adding antibiotics. Those are to prevent infection during treatment because those are pretty common. We want to prevent that,
Okay.
okay?
Mhm.
Right.
So, where do we do all these treatments?
Down the hall from here,
Oh,
this
okay.
floor,
Uh-huh.
you go down the hall, that's the infusion center over there.
Where
Do
we,
those treatments there.
Where you did your lab.
okay,
Mhm.
okay,
And then the other thing is downstairs, first floor, there's a pharmacy there. and they have venetoclax, this medicine. And so we're gonna run it through your insurance to see what they want us to do,
Mm-hmm.
but most of the time people can just pick them up there. But don't start them until your first infusion.
Correct.
Great.
Okay.
So pick them up today,
I don't think they'll be ready today.
okay,
It may
so
be
just
like
pick them
later
up
this
Monday,
week, yeah,
okay,
or Monday,
Monday,
yeah.
okay.
Okay.
Okay. So how do we know where to go then on Monday? Do we just come up here?
Yeah, you'll come
Okay.
up here, you'll check in there, and they'll be ready for you. You'll have an appointment, and you guys have the MyChart thing on your phone, maybe worth getting.
Yeah, we can-
My chart, okay,
I think.
So you'll be able to see your appointments and when are your infusions due. And you may see more infusions than you need, but we just save the spot in case you need it. But sometimes you don't need like a blood transfusion, but we save the spot. Okay,
you make an appointment for her,
Yep.
and then cancel it if you don't need it.
that's right. But you don't
Okay.
need to make appointments, we'll take care of that,
So I just have to show up on Monday.
pretty much.
Okay.
We'll be
That's
here.
easy.
You'll have two though, you'll have the appointment for the lab, because they always do lab before the infusion.
Mm-hmm.
You'll have the infusion, and then if you need it, you'll have a transfusion appointment that way, like a blood transfusion.
Okay.
So is the lab every day of those 5 days,
No,
or just the
Just
Monday?
the first day.
Just Monday,
It's usually the days that you get labs, so it may not be Monday, it may be Tuesday and Friday. Because that's gonna be a regular schedule, if that's okay with you,
Mm-hmm.
Tuesday and
the
Friday,
infusions,
the labs.
okay, sorry. Tuesday, I'm sorry, Thursday or Friday?
Tuesdays and Fridays.
Okay.
But you'll get infusion from Monday to Friday.
Oh, wow,
Yeah.
that's huge, Mom.
Yeah.
Okay, Monday through Friday, okay. And these probably don't even matter anymore, but my other sister that's a nurse practitioner lives in Colorado, she just wanted me to ask you these real quick.
Yeah.
Is it possible for this type of cancer to spread to other parts of the body?
No, it
No.
doesn't. It's not like the others, it just stays in the blood.
Okay. And stem cell transplant, is that ever done for this?
Once you get 80 and above, it's kind of difficult to live through.
Okay.
Okay.
There's high doses
Okay.
of chemotherapy, and most people don't survive it, so we stop doing it.
Okay. Sweet.
Okay.
We're lucky to be so close to this place.
Even if you were 50 years old with a P53 mutation, transplant is also a discussion. So it's not like most of my patients are 70-ish.
Mhm.
So some of them think that we're not doing it because they're too old, but that's not the case.
Okay.
So, what do you think her side effects are gonna be like? Like after this first round of the 5 infusions and the pill for 7 to 14 days?
So the medicine itself has almost no side effects as far as like, the usual chemo stuff. So Hydrea has more side effects than this, but the things that can happen is nausea, but we'll give you anti-nausea medicine just before. Almost nobody vomits, almost nobody loses their appetite. There's no diarrhea or hair loss or anything like that. The main side effect is this, your numbers dropping in the first 2 weeks. And that's why we need to keep checking twice a week.
Okay, I have that anti-nausea medicine at the house already.
Yeah, they'll give
I picked that up from,
they'll give an IV anti-nausea medicine right before they start here too.
oh, okay. Okay.
In the IV?
Yep.
An IV of that and then the, okay.
Yep.
I'm so glad we came here.
We knew you would be smart. Your first name is Samuel, and that's my grandson's name
There
too.
you
Oh,
Okay,
Other
so
questions?
this is kind of a silly question. I wanna go to my granddaughter's wedding in Michigan in 3 weeks.
In 3 weeks.
Is that a possibility?
So I would say, so what date is that?
August 23rd.